Hello Africa, you're live on a brand new edition of Ladyz Digest, where issues in the world of women are discussed. And I'm your host, Joan Akua Iyoha, and this show is proudly brought to you by AAU TV, the voice of higher education in Africa. In our previous episode, we started our discussion on uterine fibroids, and we introduced uterine fibroids, we talked about the causes, and we talked about the symptoms. So on this episode, we'll be looking at the forms of treatment. Remember to join the conversation. Drop your comments, drop your questions on our social media pages, Association of African Universities on our Facebook and YouTube pages, and our Instagram handle at Ladyz Digest. Do stick with us. We'll be right back. Dr. Udele Tagoe is a general gynecologist and minimally invasive gynecologic surgeon. She is married with 4 children. She is very passionate about delivering quality, compassionate care to women. And her hobbies are running and reading.
You may not have heard about us, but we have heard about you. You've been searching for a new kind of university that matches your ambition. Our world-class education is renowned, but there is more to us. Meet the university in Ghana that is transforming Africa. One that is nurturing a new generation of ethical, entrepreneurial leaders. One that offers scholarships thanks to the Mastercard Foundation, so that you can be part of our community of students who stand for integrity, discipline, and excellence. There is only one such university, only one, where 100% of graduates receive job offers or graduate school admissions. You may not have heard about us, but we have heard about you. You are Africa's future, and we are Ashesi University College. Together, we can begin to create a new Africa.
Welcome back. As I said before the timeout, we're discussing uterine fibroids part 2. And this episode is dedicated to its treatment. And as usual, we have in our midst our beautiful gynecologist, our regular gynecologist, and we are in an office again to discuss this uterine fibroid part 2. Welcome, Dr. Udele Tagoe.
Thank you.
It's nice meeting you again.
Same here. You're too kind.
Thank you. So we are back again to continue from where we stopped on uterine fibroids.
Yes.
And this episode we'll be looking at part 2, and we'll talk about the treatments of uterine fibroids. So let me, as a lady, I have suspicions. As we mentioned earlier on the symptoms, I suspect that, within the symptoms you mentioned, I suspect that, there are signs of uterine fibroids. Yes. What would I expect for my gynae to go through? And I think that we are talking about the diagnosis here.
Yes.
What would my gynae check for?
So if you have concerns that you may have uterine fibroids, the first thing that I would do when you come to see me is go through a very detailed history.
Okay.
Your menstrual history, the symptoms that you're having, and also your general medical history, which would include, any prior surgeries, any prior pregnancies, your family history, trying to elicit whether or not you have family members who have fibroids, if you have had any history of any menstrual irregularities in the past. The history is, in fact, the most important of any initial gynecologic evaluation. Thereafter, there would be a physical exam done. So in terms of figuring out whether or not fibroids could be the cause, the most important component of that exam would be the pelvic examination. So in this case, I would assess the female organs, again, primarily the uterus, but also the ovaries. I would feel in the area of the ovaries just to make sure that there's nothing else. Frequently, a pelvic scan would be indicated. In general, the most common symptoms of fibroids tend to be abnormal or irregular bleeding, pain, and the bulk symptoms like we described earlier. So in doing the pelvic ultrasound or the pelvic sonogram, it uses ultrasound waves to get an image of the uterus, the ovaries, the fallopian tubes, and it will look to assess, number one, are there fibroids present, but also make sure that there's nothing else in the pelvis that could be causing the symptoms. There could be signs of an ovarian mass or ovarian cyst. Sometimes there could be
You've talked about
Yes, I talked about ovarian cysts before, which are completely separate from fibroids. Cysts like that tend to grow within the ovaries and are not related to fibroids in any way. I also would do other investigations to see if the symptoms are due to other causes. Sometimes pelvic pain can be caused by infection. Sometimes the pressure symptoms may be caused by some inflammation or irritation of the bladder, or maybe something going on with the intestines. And so even though a woman may come to me and have concerns about fibroids, it's my job to make sure that I don't just focus on fibroids and fibroids alone. Exactly, because some of those symptoms I described, the irregular bleeding, the pain, the bulk symptoms, there are many other gynecologic and non-gynecologic conditions that can cause those. And so the evaluation would not only involve the physical examination, the pelvic sonogram, but if indicated, I may do certain tests to check for certain infections. I may also order other laboratory, like blood work, to check for other conditions, even conditions not related to the GYN organs at all. I can check the thyroid hormone. The thyroid is a gland in your neck that's responsible for your metabolism and other bodily functions. If there is an imbalance in the hormones produced from the thyroid, sometimes it can lead to irregular bleeding. If there's infection, it can cause some of the other symptoms. And so it may seem like a woman has fibroids, but in addition to evaluating that, it's also important to make sure there's not other causes for the woman's symptoms.
So in the process of going through this, would you consider, you mentioned the historical history of the woman.
Yes.
Would you want to consider if the lady has undergone some series of abortion before, can it be a cause?
Abortions are not a cause of fibroids at all. Now, I will elicit that history anyway, because it's important as a gynecologist that I know the woman's full history in terms of even knowing what I'm going to check for. But in terms of specifically if abortion is related to causing uterine fibroids, no, it's not.
All right. So upon this series of investigations and tests that's been done, and it's been diagnosed that this lady has uterine fibroids, what are the possible treatments that she would have to undergo?
There are many different treatments for fibroids, including doing nothing, if you can consider that a treatment.
I see, doing nothing. Okay.
Yes.
Some people may pick that option.
Some people may pick that. So it may be the case that a woman may notice some symptoms. And let's say there's another cause for the symptoms. So for example, irregular bleeding or heavy menses. Let's say we do a hormonal evaluation and I see that there's some kind of hormonal imbalance, but also in the course of the evaluation, we see that there's 1 or 2 fibroids there. But they're small, there's only 1 or 2.
So not that big.
It's unlikely that that will be the cause of the woman's irregular bleeding, especially if there's significant abnormality found in the hormonal evaluation. So in that case, our focus would be treating the hormonal imbalance, and we would just leave the fibroids alone, you see. So it's really dependent on what has all the total evaluation shown and what is the most likely cause of the symptoms. Now, if we determine that the fibroids are the cause of the symptoms, then there's many things we have to consider in terms of choosing the proper treatment. Number 1 being, what is the main symptom the woman is having? So if the main symptom is abnormal bleeding, And let's say she either is not interested in fertility, meaning having a child at that moment, not in the future, but just at that moment or within the next year or two, she's not interested in having a child.
Or maybe she's done giving birth.
Or maybe she's done with her childbearing. Then in that case, we would try to see, okay, are you just okay with just treating the symptoms related to the fibroids, meaning the heavy bleeding, if that's the main symptom, or do you want to have the fibroids just gone altogether? And so based on her desires for fertility, what the main symptoms are, and what the size and number of the fibroids are, that's what determines what you choose in terms of the treatment. So there can be medical treatment where primarily it's hormones or family planning, so birth control pills or sometimes some other hormonal medications which can be used to control the bleeding. Family planning is not just for birth control or controlling the number of pregnancies or preventing pregnancies. It also can be used to help regulate and lessen the flow of the menses. It also can decrease the pain associated with the menses. So when you have fibroids present, if they are small, they're not causing too much in the way of pain, etc., there's not a need for pregnancy. Some women need to be pregnant right now. That's why I said need.
That is true.
But if they're okay with deferring fertility for the time being, sometimes you can use medications like contraceptives, etc., just to control the heavy menstrual flow being caused by the fibroids. And sometimes that's all you need. Now, if a woman does want to conceive, or let's say there are many fibroids, or the fibroids are very large, or if the bleeding is so heavy to the point where it's causing anemia. Anemia is a decrease in a woman's blood count, sometimes to the point where it can cause symptoms like lightheadedness, dizziness, heart palpitations, which means that your heart is beating faster because you have less blood in your system. It can be quite dangerous depending on how low the blood count goes. So in those cases, that's where you start to consider maybe some medication treatment or hormonal treatment, and then the next step, which would be surgical removal. So for women who want to conceive or maintain their fertility or just don't want to part with their uterus, which we'll talk about later, in that case, that's when you consider surgical removal of the fibroids. Okay, surgical removal of the fibroids could be just taking the fibroids out and leaving the uterus in place. Obviously, if a woman wants to conceive, we would do that first. Also, if a woman is done with childbearing, and they're maybe of older age, maybe getting closer to menopause, and they want to have the fibroids removed. In that case, there's really no need to conserve the uterus just because they're not going to be conceiving anymore. So in that case, you can choose what's called hysterectomy, where you remove the entire uterus and thereby all the fibroids at the same time. So, there are other treatments. Women also frequently ask me, is there anything that can make them shrink and go away altogether? There are means to shrink the fibroids. It's uncommon, though, that they will disappear completely. Frequently, in fact, when a woman chooses surgery for fibroids, many times you may need to do a hormonal treatment. Again, if there is anemia and the blood count's low, you don't want to go into surgery with a low blood count. It just increases the risk of surgery and it makes the recovery less optimal, okay? So in that case, sometimes you need to give hormonal medication to stop the menstrual flow so they're no longer losing blood and allow the blood count to build back up to normal. And then thereafter, you would do the surgery. So sometimes it's a combination of treatments that you will need to do based on the woman's condition. In terms of shrinkage, those medications you would give for about 3 months, and it does help the fibroids to shrink down to a certain extent. Not 100%, but maybe about 30 to 35%. Exactly. And when you do that, there are a couple of benefits in terms of surgery. It usually makes the surgery an easier procedure. Like you mentioned earlier, I do minimally invasive surgery where instead of trying to do a big cut on the abdomen, like a CS or C-section cut to get the fibroids out, we try and use smaller incisions to get the fibroids out. So when you pre-treat, when you pre-treat with those hormonal medications, it usually makes it more likely that a minimally invasive approach will be successful and that an open surgery may not be necessary. It's not always possible for all women, but in certain cases, it is possible to do that.
Yeah.
Okay. There are other medications, or other treatments, I should say, which can help to shrink the fibroids and don't involve actually removing them. And sometimes even just shrinking them is enough to allow the woman to have relief from the symptoms, the heavy bleeding, the pain, the pressure. One of those treatments is called uterine fibroid embolization, or UFE, also called uterine artery embolization.
I prefer the UFE.
UFE is easier to remember. And that is actually a procedure. It's not done by a gynecologist. It's actually done by a specially trained radiologist, the doctors that do the x-rays, CT scans, and all of that. And what happens is they will identify the major blood vessels, which are the uterine arteries, which is why it's also called uterine artery embolization. The main blood vessels that feed the uterus and therefore the fibroids. They will identify those vessels and insert a certain substance which will block the blood flow to the fibroids.
Okay.
Fibroids grow not only by hormonal stimulation, but by also making new blood vessels form around themselves. Wow. So when you can block the blood supply and thereby the main food source, so to speak, when you block that, then they start to shrink. And even if they don't disappear, even if you get 30 to 50% shrinkage, that's usually enough to control the symptoms.
Yeah, at least it won't expand.
Exactly. Now that usually has good effect for about 5 to 10 years. And also it is something that can help the women to avoid surgery. Sure. However, it's not recommended for women who still want to conceive. Exactly.
Okay. We'll go for our Tips in One session.
Sure.
We'll go back. Stay tuned for Tips in One. We'll be right back.
Hello there, welcome to Tips in One segment on Ladyz Digest. Today we are talking about uterine fibroid. According to the World Health Organization, fibroid is extremely common. The report states as many as 80% of African American women and 70% of Caucasian, Hispanic and Asian women develop uterine fibroids by the time they are 50. Doctors don't really know the cause of uterine fibroid, but research and clinical point out genetic changes, hormones, extracellular matrix, and other growth factors as major causes. Symptoms include heavy menstrual bleeding, menstrual periods lasting more than 1 week, frequent urination, constipation, back pain, and leg pain. Seek medical attention immediately you notice any of these symptoms. Preventing uterine fibroids may not be possible, but it's only a small percentage of these tumors require treatment. But by making healthy lifestyle choices such as maintaining a normal weight and eating fruits and vegetables, you may be able to decrease your fibroid risk. Enjoy the rest of the program.
Welcome back, and if you just tuned in, this is still Ladyz Digest, and you can always drop your comments and your questions on our social media handles on Facebook and YouTube at the Association of African Universities and our Instagram page at Ladyz Digest. And we are still discussing uterine fibroid, and this is the part 2. Thank you, Doc, for sticking with us.
Sure.
And you talked about we just discussed the treatments of forms of treatments of uterine fibroids. Mm-hmm. So, for instance, as always, we have been diagnosed. Can I just tell my doctor? For today, I come to my gynae and I know I have the uterine fibroid. Can I just tell my doctor that, okay, doctor, tomorrow I'm ready for you to, if it's maybe, let's say it's the surgical one, can I just tell you that, okay, doc, I'm ready for treatments tomorrow? Is it possible?
You can tell me whatever you want.
Okay, it's my own.
You can tell me whatever you want. But in general, we always want to prepare. Okay. Surgery is never a light undertaking. Okay. You know, any surgery is a major undertaking because it's anesthesia, medications that you will be getting that alter your blood pressure and your heart function. And also you're having cuts made on your body. And so it's important to make sure that we do some preliminary evaluation to make sure that it is safe for you to undergo surgery, and that as much as possible, all of the conditions are as optimized as possible. You know, there are some women, you know, again, fibroids affect women in their reproductive ages. So that's all the way from the teens to early 20s, all the way up through menopause. As we women age, men as well,
Yeah.
it's more common for us to have other medical
Yeah,
conditions.
yeah,
So
yeah,
sometimes
sure.
hypertension, diabetes, other conditions, even thyroid conditions,
Yeah,
things that we
sure.
need to make sure are well controlled before we go into surgery.
Surgery.
So although most women are like, okay, doc, I have fibroids, I want them out yesterday. I usually say, okay, it's usually the case we can schedule it within a reasonable time frame, within 1 to 2 weeks, as long as any pre-existing medical conditions are well controlled. So let's say a woman does have high blood pressure or diabetes or any other condition, but I see that she's on medications, blood pressure is well controlled, or her blood sugars are well controlled, then in that case, usually within the next 1 to 2 weeks, we can go ahead and schedule.
Okay.
However, for the younger women who may not have any pre-existing medical conditions, but let's say if the main symptom from the fibroids is heavy bleeding, I need to make sure her blood count is well controlled, or her blood count is at a normal range, I should say. Obviously, when you have surgery, you're going to have incisions made. It's not uncommon that you'll have some blood loss, especially when you're coming with fibroids and you're going to have surgery for it. Sometimes there can be a lot of blood loss because, like I said, fibroids cause new blood vessels to grow around themselves. So if I do see evidence of anemia, I may say, it's better if we build your blood count back up to normal. So we go into surgery with a good blood count. So even if you lose some blood, it won't affect you as much in terms of causing severe anemia. Okay, severe anemia is not good going into surgery. So we may need to do that. Additionally, there are other people involved in doing the surgery, not just me. So there's the anesthesiologist, the nurses, etc. And I work with other specialists as well, and so we all share our theater. So we want to make sure that we time the procedure in such a way that the anesthesiologist also has a chance to review the woman's medical history and make sure there's nothing else that needs to be done. If there are any other testing, and there frequently are other tests, blood work that we need to check in preparation for surgery, we should do that ahead of time. And then we also make sure we set the schedule such that it doesn't conflict with other people. So sometimes people wonder why they can't get their surgery tomorrow. We plan everything, and it's all in efforts to make sure that the procedure is done as safely as possible for the woman to have a good outcome and good recovery.
Wow. Just a quick one. Is it safe for pregnancy to be side by side, or fibroids, the uterine fibroids, to be side by side with pregnancy?
Yes, it's very common, in fact. So that's the reason why I said it is not always the case that fibroids can cause infertility. There are many women, in fact, who have fibroids and conceive and deliver without difficulty. And so in those cases, it's usually the case that maybe they have some few fibroids, they're small, and we don't worry about them at all. There are also some cases where sometimes there are large fibroids, but the woman still conceives. We don't do anything with the pregnancy, we just watch and see what happens. However, we do know that the larger the fibroids are when a woman conceives, the more likely there may be pregnancy complications. So sometimes, like I said, if there are fibroids within the muscle wall of the uterus and they're large, it could be the case that because they are also expanding the uterus, it's kind of taking the space that the baby needs to grow. And so it could be the case that there could be increased risk of miscarriage. There could be incidence of preterm labor. Term is when the woman goes a full 9 months or 10 months, as we doctors like to. So but in general, 9 months is a full term. But prior to that, so prior to 37 weeks is the technical diagnosis of preterm labor. When someone goes into labor before then, that's preterm labor. There can be an increased risk of that, the larger the fibroids are if a woman conceives with fibroids in place. Additionally, even if there's not preterm labor or miscarriage, as the baby grows, because pregnancy is a high hormone situation, you have elevated female hormones in order to support the growth of the pregnancy. Those same elevated hormones also stimulate the fibroids to grow. Because like I said previously, fibroids grow in response to our female hormones. And so it may be the case that, okay, the baby's growing, the fibroids are also growing, but the blood supply to the fibroids only remains on the surface of the fibroid. So if my hand's a fibroid, the blood vessels are only on the outside. They don't go to the inside. So the larger the fibroids get, the cells on the inside of the fibroid don't have blood supply anymore, so they start to die. They don't shrink.
Okay,
They start to die inside. And what that leads to is a lot of pain. And so I have seen cases, now I don't deliver babies anymore, but previously when I did, I have seen cases where women will come into the emergency unit and they have so much pain from their fibroids because they are starting to die inside because they've enlarged to the point where the inside doesn't have an adequate blood or oxygen supply. And so we really have some considerable difficulty in terms of trying to give pain medications to control the pain. And bear in mind, because of the pregnancy, we have to be cautious about what pain medicines we give, what's the amount that we give, so it's not something that's going to be harmful to the baby. And so these are some of the things that can occur when a woman gets pregnant with fibroids. However, there are cases where sometimes women get pregnant with fibroids and they don't cause any problems at all. It really depends on the size, the number, the location of the fibroids.
Wow, thank you very much.
You're welcome.
For, as I always say, for squeezing time to always give us part of your knowledge, share your knowledge.
No, this is very important. All women should have this knowledge, which is why we have these discussions. At least it can empower women to go to their doctor and ask questions. Every woman should be encouraged to ask questions and have an answer as to what's going on with their body.
Thank you very much.
You're welcome.
Hey viewers, this has been Ladyz Digest, and I've been your host, Joan Akua Iyoha. You can catch up on our social media handles at the Association of African Universities Facebook and YouTube pages. Many thanks to my production team for making the show a success. Bye.